Hello, I'm Dr. Eric Guy. I'm out of Texas. I'm an internal medicine board certified doctor, and I would like to be talking to you about obesity, diabetes statistics, and really the epidemic of obesity. And what is obesity? I think we all really know what obesity is, and but what is it by the math formula? It's a BMI greater than 30. It's considered to be obese. It says very obese here, but there's also categories of obesity: type 1, type 2, type 3 obesity. But if you're 25 and above, you're overweight. Okay. Normal 18 to 24.9. So this is Dwayne Johnson, and he's not obese, but he's considered obese based on his BMI because muscle is dense, it's heavy, and he may have the same BMI of this cartoon on top of him. So we all know that that you have to look at a person's physique to be able to predict if they're really obese. This is the side profile of people may look like this and obese. It turns out that if you can put a straight line between your chest and your belly button, then basically your normal body weight. And anything more than that, if you have like an apple here or convexity or right there, a little lump from the side, then you're overweight, okay? And that's the majority of people are from this point on over. Obesity before 1980. And 1980 is a very significant date when it comes to the obesity epidemic because that's when it all started. And really the story starts with something called high fructose corn syrup. But the prevalence of obesity before 1980 is around 15%. And it was 15% for many, many years. I don't know what it was 1,000 years ago. I mean, I bet it was less than that, but pretty much in modern society, it's 15% in the United States. What is the prevalence today? Any guesses? It was 15% before high fructose corn syrup. Now, believe it or not, it's 35%. I shouldn't have told you that. Here it is, 35%. Okay, so that's pretty high, right? 35% obese. What is the prevalence of just being overweight? Okay, that's this gentleman to the right. What is the prevalence? 40%, 50%, 70%, or everybody? I would say everybody, basically, but you do have some genetic freaks. They're actually considered that, and they can eat a lot, and they're not gaining weight. And we can explain that at another time. But that can happen actually. But it takes a lot of dietary discipline, basically. It takes 70%. 70% of people are considered. Sorry, let's go back. 70% are considered to be overweight or obese. It's a high number, 70%. So this is the graph where you can see the percentage of obesity versus high fructose corn syrup. And it's obvious that between 1975 and 1985 that there was just an exponential growth in the use of high fructose corn syrup. The reason was it was cheap and a lot cheaper than table sugar. So that's what happened. And obesity started taking off around that time period after 1985. It's been increasing. And this graph shows in 2000. We're now in 2020. So in 2000, the obesity rate was around 25%. Now it's 35%. So it's went up from 25% to 35%. And that's in 20 years. Okay. Didn't quite double, but man, it's doubled since earlier. It's really taken off. So the graph shows the relationship between mean body weight and diabetes on the left. That's almost a direct correlation, right? And to the right, the graph shows that if you gain 15 kilograms from a stable weight, let's say you're not diabetic, so you're probably pretty much normal body weight. And if you gain 15 kilograms, you have a relative risk of 6 times more by gaining that weight of having diabetes, whether you're a male or female. That's huge. And so that's what happens if you gain the weight, if you let yourself go and you eat at these places, eat out a lot where there's a lot of high fructose corn syrup. But because that's a bad story, that also you can look at it, well, there's a lot of potential to lose your diabetes by losing that weight. And I promise you that can happen. As a physician, we're not really taught to tell you that. We're taught to tell you to, you're going to have worse and worse diabetes as you age, and you're going to need more and more insulin. Okay. But that is not what has to happen. Okay. But if you hit it hard, especially when you're pre-diabetic, there's a good chance you won't ever be diabetic. But you have to make a major change, and as this graph shows. Okay. So we all know people who are like this. It's he didn't choose to be this way, and it really is not his fault, because the high fructose corn syrup that comes from corn to his right is actually the fault of this. And what has high fructose corn syrup? Well, yogurt. I'm not talking Greek yogurt that has low sugar or low high fructose corn syrup. I'm talking yogurt that really tastes good. And so if you're getting that thinking you're being healthy, let me warn you, it's the number one with high fructose corn syrup. So does breads, frozen pizza. I don't have to read the whole list, but look at applesauce. I used to eat that all the time when I was a child. Can you believe that? And no wonder I loved it, but it's not good for your kids. Don't give them applesauce. Okay. Look at this tomato-based sauces. Make your own spaghetti like I do. Okay. You won't get the high fructose corn syrup. Oh, I'm sorry. I just want to show this. High fructose corn syrup has been linked directly to obesity. I'm telling you that. I'm just reading it. Diabetes and metabolic dysfunction. All right. So, who produces high fructose corn syrup? You have to have pretty much a factory in your backyard if you want to produce it yourself, or maybe you're a chemistry genius and you can do it, but most people cannot do that. So if you're getting it, it's because it's in the box food you're getting, or the pizza, or the yogurt, whatever, you're getting it and you're eating that stuff. Okay. And it's poison. It's horrible. It's hurting you. But there's other names for high fructose corn syrup. Look up here. In Canada, it's called isoglucose, natural corn syrup, maize syrup, fructose corn syrup, fructose isolate, fructose, and glucose syrup. They're all the same thing. Read your labels, okay? Don't be fooled. These companies will fool you. They're going to sell it to you. They're trying to make some money. But that's what happened to you. So high fructose corn syrup is the same thing as table sugar. Table sugar is 50-50, 50% fructose, 50% glucose. High fructose corn syrup, 55% fructose, 45% glucose. Okay, it's basically the same. All right, this HFCS 90, that's a pure toxin. That stuff like that'll kill you, man. It's so sweet that it's not used very much. But it turns out the liver is the only organ that can metabolize fructose. Okay, and insignificant amounts, minor amounts in other organs, tissue. But when it gets overloaded, guess what happens? Okay, it's not sent to other tissues. It's turned into fat in the liver. And unfortunately for most people, it causes a lot of problems in the liver. And there's going to be a problem with the epidemic of cirrhosis from NASH. And I'll have to give another lecture on that, because that's coming, because obesity is here. And unless we do something about it, NASH is coming. It's non-alcoholic steatohepatitis. It's a form of cryptogenic cirrhosis. Alrighty. So this is the effect of fructose in your body. We already talked about the inflammation in the liver, dyslipidemia, steatosis, but it causes inflammation in your body, and generalized inflammation, because that's what fat does. Okay. And it's found in the mesentery around the intestine. You can see that. If you see your belly, if it's protruding out, it's because you have visceral fat. Now that's worse than having it around your hips, like a lot of ladies have it. But it's there, and it's very dangerous. The National Diabetes Statistical Report 2020, as per CDC website. This is where I'm getting these statistics. Okay. Turns out that diabetes is in 10.2% of the population. 2.8% of the population, they don't know they're diabetic, but if you check their blood, they're diabetic. Okay. Undiagnosed. 13% is the addition of those two. That 13% are diabetic or not, they don't know it. Now, pre-diabetes is 34.5% of the population. 88 million people. Okay. That's huge. Okay. 1 out of 3 people. If you add that together, 47.5% of people, that's the number you need to remember from this lecture. 47.5% of people are pre-diabetic. They don't know they have diabetes, or they have diabetes. Huge. Okay. It has huge ramifications on the health of the people in this country, and the cost that's coming in the future. I mean, it's billions of dollars to pay for the medical care of a lot of people who are diabetic. And a lot of people who develop problems, and because 70% of people are overweight, so 47.5% of people have the diabetes. So a large percentage of people are developing problems before they're considered to be obese, because obesity is what, 30%, 35%. So 35%. Here we go. 77.8% of patients are diagnosed with diabetes by a provider. So they're being taken care of, almost 78%. That's really good, actually. 24.2% of diabetics actually exercise 150 minutes per week. This is deliberate exercise. Okay, it's not going to work and just walking more. It's actually exercise. Okay, so that's not good. Okay, only a quarter of people are actually doing exercise when they know they have diabetes. That's not really good. Now, these same people diabetic, 77% say that they are losing weight or that they're managing their weight. So I don't know. That doesn't correlate too well. 58.4% of people who have diabetes, who are between the ages of 40 and 75, are taking statin medication. And that's not really good, because statin medicine, pretty much everybody with diabetes should be on it, because the reason is because if you have diabetes, your chance of having your first heart attack is pretty much the same as somebody who does not have diabetes, who had their first heart attack having their second heart attack. Okay, think about that. So pretty much, if you're middle-aged and you have diabetes, we pretty much think you have coronary artery disease, and you're going to be on a statin medication. Only if the rare case that you don't tolerate it should you not be given it. But that's not very common. Okay, it really isn't. So this is not good. That only 58.4% are on statins. Okay, so look at this statistic. It's not very good either. 19.2% of patients who are diabetic are at their goals of hemoglobin A1C less than 7 and blood pressure less than 140/90 and low non-HDL cholesterol less than 135 and not smoking. Okay, so really, if you're diabetic, you should not be smoking. That's pretty much suicidal. It really is. I'm not trying to, scare you here. There's no reason for me. I'm just presenting the information to you. And I know that smoking is actually really bad for your health. And you can leave any comments. I'll be happy to talk to you about that. So it turns out that if you're Asian, you suffer the consequences of diabetes at a lower body mass index than a Caucasian. Polynesians the same, and Indians. So that it's really, really bad. Okay, you need to get a grip on it. In summary, high fructose corn syrup is definitely connected to our epidemic of diabetes. 35% of people are obese. 70% are at least overweight. 47.5% of people have pre-diabetes, undiagnosed diabetes, or diabetes. 1 out of 2 people basically walking around. Although most people do receive care, the care is usually inadequate. Okay, so I hope you enjoyed this and learned something, and I thank you.